Is it likely that the 0 to 90, limiting it to 90 days will drive the percentage down?
I can't say how it would drive the percentage down. Certainly, we would expect that it would reduce that percentage, yes. I don't know if it's linear, I guess you would say.
That goes to the impact on your business plan.
Yes. It certainly will have an impact if those donors, again, if a donor knows very early on that they are a high producer and contacts us, and we have minimum amounts to start. So 350 ounces is the minimum they have to have just to donate the first time. And they know that very early on, then by the time they get 90 days out, they're generally struggling with what to do with all of that milk. Those are the donors that we're looking for.
And then the donations would continue 120 days, 180 days.
That's correct. We require that they re-qualify on a every 4-month basis, but yes, they can continue to donate as long as they choose to express milk and wish to continue as a donor.
But it seemed to me that analysis would play into trying to figure out whether this action is going to interrupt the flow of a needed product to the neonatal intensive care folks, right?
Right.
So somebody should do that analysis as if this bill moves forward. Thank you, Mr. Chair.
Okay, seeing no other questions, I have a couple comments and I'm going to have some questions. Let me just kind of recap what I understand, that whether you're a nonprofit or a for-profit, the nonprofits collect the milk but don't pay for it. The for-profits collect the milk, pay for it, but both the nonprofits and the for-profits sell the product. Is that correct?
We consider it a service, sir.
Oh, but you still generate a revenue from it.
Yes,
So you
there
get-
is a service charge.
you get a service charge.
$75.
Well, but you still generate revenue. Okay. All right. So, but what I've heard through the testimony, especially from the nonprofits, I wrote this down, impact on donation levels. Do you feel that there is a direct impact on your donation levels because of a business practice like this? Yes or no?
Yes.
Okay. Well, I would hope that we're not creating policy for that reason. I hope that's not the reason why we're doing this. I'm assuming that we're having this discussion because you believe that if you sell milk, that person is less likely to give that milk product to their children. Is that correct?
The issue why we support.
Yes or no?
No, that's not the reason why.
Well, so, but that was part of the policy argument, that you're afraid that by selling the milk, that the mother is less likely to give the milk to their children. That was in your statements. I believe I heard that.
That's correct.
That's correct, okay.
Purchasing that it is a disincentive.
A disincentive, right.
Encouraging the lactation
Right.
and the breastfeeding
Okay.
for the
So
baby.
do you have empirical data that'll show that? Is there any kind of empirical data? Because that's what I was asking the author for. Is there any empirical data that would show that?
The women not providing their milk to
Yes.
babies. I don't have that
Okay.
data.
So my understanding is that you as a nonprofit do not fortify it, but you give it out at a reimbursement rate or whatever it is. But now we have an entity that fortifies it for a NICU, which is for neonatal children, which very, very rare and unfortunately some devastating conditions, okay? What would happen if there was an unintended consequence where an entity like this particular entity doesn't have the ability to provide that product to a very fragile population? What should we do then?
It's not a yes or no question.
No, I'm just
Okay.
curious.
So
Because
essentially,
your comment earlier
Right.
was that it's impacting your business model.
the impact for the nonprofit milk banks is this, that the concern is we want equity, that the babies, even though that are less than a certain size, and who uses the product, their product. There are multiple products, including Prolactis product, that is available to the NICU and the neonatologists to provide that type of fortification. I'm not suggesting that I know any different, whether his is better or not. I'm saying there are
still a
other
fortified
alternatives.
product, though. It is
It is a
some
fortified
type of
product.
fortified
That is
product.
something that the nonprofit milk banks do not provide now.
So here's the dilemma that I have as a chair, is I have to outweigh the balance of the policy that's in front of us, because there is a value to what they're doing, is they're fortifying the milk. And I don't want to see that it shifts so that there won't be that balance available. But and I can understand the policy argument that if you incentivize it by payment, that you may get a small percentage or a certain percentage of women that aren't going to give it to their children in lieu of generating revenue, whatever the case. But then there's another element, and the reason why I was torn by this and why we had this conversation is there's still the choice by the parent of what they choose, or the mother, of what they choose to do. So that's why I was kind of torn. So when I spoke to the author, in respect to the author, I had asked them to move. I was originally not going to support the bill at all, but I asked that we move from 180 to 90 days to have some type of compromise to see if there's a way that we could have some resolution. But I hope that in the future that we don't see, to address your concerns about impact on donation levels, that we're now going to have an impact on the NICU. So that's another one of my concerns, okay? So I'm prepared to support the bill at its current form, and I did ask the author to take those amendments, and I want to thank you for it.
And I want to thank you for working with me in doing that.
And I'd like to just make one other clarifying comment. I think Senator Pan made a comment with regard to the ability for Prolacta to accept milk without payment, that we got to make sure that we correctly amend that such that they are allowed to do that. Once they collect the milk, then after that, then they can sell it. You know, if you want, they can even probably sell it at a higher rate, assuming that they want. But the first 90 days, that they're still allowed to accept that milk, or accept the mother's milk. So, yes, Senator Roth.
Chair, assuming the bill moves out of this committee today, I would like some additional information on the question that I asked with respect to the 0 to 90 donor group, with respect to your business plan, which you're concerned with, and what I'm concerned with is the availability of your product in the neonatal intensive care units.
Yes, sir.
So that would be instructive to me. And maybe I missed this. So what do you all charge per ounce?
It's a complex question because the product is not, it's not milk that we take and fortify. It is milk that is, we take the milk and we concentrate it. So it's 100% human milk based nutrition. So we're essentially removing water. So we have a concentration factor of about 10 times. Then we have to fortify that with some minerals and that sort of thing. We have to fill it in a clean rooms. Because we are in a remunerated model, we have a large amount of testing that we do, including drugs of abuse. So we have a high cost associated with it. So the product itself is about $6.25 a milliliter as a fortifier. But that is a product that's used in the first 60 days of that premature infant's life in the NICU. And it's not their entire feeding. It's mixed with mother's milk to bring up the nutrient content using 100% human milk nutrition.
I flunked equivalencies, so can you break that down for me and translate that into an ounce? Because I assume the nonprofit has to do the same type of testing before they release their milk.
No, I would not assume that that's the case.
Oh.
For example, the milk that we collect is tested for 7 different classes of drugs of abuse, including nicotine. Nicotine being the most common thing that we find in donated milk, whether you remunerate a donor or not. That's the most common thing that's in there. We test for adulteration of the milk, including cow's milk, goat's milk, soy milk, those types of things. We test for water dilution. We do a genetic match, meaning when mom qualifies as a donor, I generate a DNA profile from her, and then I match the DNA profile in her milk to ensure that that milk came from that donor and only that donor. Because coming from the plasma industry, I would expect to be able to see an ID and collect a sample from a donor. I can't do that for a mom. So I need to know that that milk comes from that donor and only that donor. So we have a number of tests that we do that are not necessarily done by other milk banks.
Well, my colleague Senator Pan aced his equivalency course, so he tells me it translates into about $195 an ounce.
Yeah, I don't have a calculator, but yes, okay.
Okay, and yours is $1.75?
It's $3.75.
$3.75. Okay.
And it doesn't, I mean, this isn't,
And again, not equivalency, so an ounce of milk is very different than an ounce of fortifier in terms of how much is used.
I
yeah.
understand. I just was curious. Nobody talked about it, and you're a profit and she's a non-profit. But I would like the information that I asked for at some point
Yes.
before we vote again on this. Thank you, Mr. Chair.
By all means, and before Senator Mitchell's going to have another follow-up question, but I want to just verify with Senator Wolk that we need to clarify in the language, whether it's probably in the next hearing, that a for-profit sells ability to collect the milk but can't reimburse for it, but that they can continue to collect
Right,
the
it's
milk.
the remuneration that's the issue.
Right, I get it.
Clearly.
And yes, Senator Mitchell.
I need clarification on that. So they can collect it within the first 90 days?
They just can't pay for it.
And so will they pay her for that first 90-day period after the 90 days, or that's just a donation?
It's just I'm assuming it's just a donation. There's no payment at that point.
So then when we talk about the profit margin, it's even bigger because they haven't even paid out for what they're going to give. I don't know that that makes it any better. I just want to tip my hat to you, Mr. Chair, and that's why you're the big boss. And I appreciate you clarifying the policy issue before us. It is not our role as policymakers to guarantee a product for a nonprofit.
Right.
I came from the nonprofit industry. I appreciate you're mission-driven and you have a role, but that should not be the focus.
I agree. That's not our role here.
And that's another example of when I said that some of the debate around the bill added mud to the water in terms of the pure issue. So thank you for providing us all with that clarity. I appreciate that.
Senator Pan.
Thank you. So I just want to clarify also is that whatever the witness said in terms of the policy issue, I mean, one major one for me is actually creating incentives. Again, this is about the public good, and that's our interest. It's not the interest of any nonprofit, for-profit, whatever. And so, we want to be sure that babies have access to breast milk, that we improve breastfeeding. And I think that that's certainly a very high priority for me. And there's two layers to that. So one, of course, the mother who contributes, who also has their own child, and also the supply of breast milk that's available to mothers who cannot or have difficulty to have that available as well. I mean, that is also another user of the breast milk banks, and we want to be sure that those supplies are available too, as well as, of course, certainly our premature babies who need access. In fact, there's a bit of overlap between the two, because you just heard the fortifiers used to mix with breast milk, which may actually end up being donated breast milk as well.
Correct. Yeah, that's true.
Senator Hall, question.
Yes, thank you, Mr. Chair. So would there be a shortage of milk for the specialized needs or special needs, those individuals, babies, infants that are in need of specialized milk?
That would be a concern, yes. If we could not collect, or depending on how the bill is amended, if we could not collect that milk within the first 90 days, that would be a concern of ours, yes.
And that's what's my concern as well. And that's why I posed the question, what would happen if now you're going to have a product that benefits very vulnerable children? What do we do? Do we readdress this? And, and so that's the dilemma I had,
That's also a concern for the nonprofit milk bank that provides the product to all.
Yeah, but I'm just concerned about the special milk that's for those those that are in need in the hospital or so forth and so on. That's really my concern, is making sure that, I'm not passing legislation that would have an adverse impact on a special need. Those in a hospital, those who would not otherwise be able to be nourished through milk. I don't.
So I have And I understand the concern about on the other side, but if we look at the overall population, which is probably a much more relatively, maybe healthier population compared to an unhealthy, here's a suggestion, doesn't mean you have to do it. Just because this could be complicated policy in the future with unintended consequences, would you consider a sunset to see what the unintended consequences are? And if that's the case, if let's say we have a 5-year sunset, and if there's a negative consequence, then it sunsets, and if not, then you reauthorize it. Just doesn't mean, I'm just posing it.
I think it's an excellent suggestion. I've never been opposed to sunsets. I don't think
So 5 years?
sunset makes a lot of sense. Yeah, there is concern. But I wanted to just as part of my close, Ed,
I think Senator Mitchell.
I wanted to respond. Okay.
I was just going to also ask the question raised by Senator Roth, if that information could be given to us as soon as possible in terms of how your supply would be impacted with the 90-day delay.
Yes,
If you could get that to us, that'd be helpful. And whatever position I take today, Senator Walk, I reserve the right to change it as the bill moves through the process, as we get additional information. Thank you.
Mr. Chair, I'd like to reserve the same rights, and thank you.
So, okay, let me reiterate what I think we're having the discussion right now is that there is an ability, we're going to clarify in amendments that they can receive it, they can't pay for it. Well,
90 days.
90 days, and that we're going to have a sunset of 5 years to determine, and if it's fine, then we're going to, well, I won't be here then. Next group of legislators will have to deal with it.
Second that.
So, anyway, we're in understanding then on
We
that?
are indeed.
Okay, all right, and with that, would you like to close?
Yes, very briefly. We have focused on one company, but there are other companies who make similar products and have a 90-day window during which they do not pay for donations, and they are profitable companies, Medilac being one of them. So with that, I want to first thank you for the excellent discussion today, and I appreciate the work with the chair and the staff, and I would ask for an aye vote.
Thank you. We are at item number 11, SB 1316, due pass as amended to appropriations. Call the members. Oh, is anybody, can we get a motion? So moved by Senator Pan. Call the members.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Nguyen, no. Hall. Hall, aye. Mitchell. Mitchell, aye. Monning. Monning, aye. Nielsen. Pan. Pan, aye. Roth. Roth, aye. Wolk. Wolk, aye.
Thank you, Mr. Chair and members.
That's 7-1, enough to get out. We're going to place that bill on call. We have an absent member. Thank you very much. Are you ready? Now,
Galgiani left.
yeah. We're in, seeing Senator Galgiani not here, we're going to move on to item number 2. Can we please have some quiet, please? Shh. We have some members are presenting. Item number 2, SB 969, Nguyen, Vietnamese rice cakes. Good afternoon and welcome.
Good afternoon, Mr. Chairman and members. Today, I am honored to present SB 969, which seeks to allow Vietnamese rice cakes known as bánh chưng and bánh tét in Vietnamese to be sold at room temperature. I am happy to accept the committee recommendation to amend the period of time to 24 hours instead of 48 hours. I would also like to thank the chairman and your staff and the committee staff for working with us on the amendments. Vietnamese rice cakes follow a traditional recipe that has been passed down for hundreds of years, generally prepared for Vietnamese holidays such as Tet, which is the Lunar New Year festival, Vietnamese rice cakes involve tightly wrapping sticky rice, mung beans, and banana or pork into banana leaves, and fastening the package with bamboo strings. Once wrapped, these rice cakes are boiled for more than 10 hours to remove any bacteria. The common practice for these rice cakes is that they are prepared in the morning and sold within a few hours. Refrigeration or freezing of these rice cakes gives them a hockey puck consistency, rendering them inedible to any customers. This is not the first time the legislature has created exemptions for traditional Asian recipe. In 2001, the legislature passed AB 187 by then Assembly member Senator Carol Liu, which created a similar exemption for Korean rice cakes to be sold at room temperature. However, Korean and Vietnamese rice cakes are very different products and do not meet the same definition currently in law. In 2010, the legislature also passed SB 888 by then Senator Yi to allow for Asian rice-based noodles to be sold at room temperature for up to 4 hours. 10 years ago, the Department of Health was required to conduct a food safety study on Vietnamese rice cakes. The Vietnamese American community has been patiently awaiting legislation that would allow the traditional rice cakes to be sold in stores legally at room temperature. This bill has received widespread support from Vietnamese American organizations, as well as from cities and council members with high Vietnamese American populations and concentration, because they understand the cultural importance of this measure to their constituents. I respectfully ask for an aye vote to protect and allow Vietnamese Americans to be able to celebrate their heritage and tradition. Joining me today, we have, to my left, is Garden Grove City Council member Phat Bui, San Jose Council member Tam Nguyen, and our very well-respected community activist and member, Attorney Jenny Do.
Good afternoon, Chair Hernandez and members of the Senate Health Committees. I am Council Member Phat Bui of Garden Grove City, the fourth largest city in Orange County with more than 60,000 Vietnamese Americans. On behalf of the city of Garden Grove, I'm here today to talk about the importance of SB 969 to the Vietnamese American community in Orange County. Garden Grove City Council unanimously supported the bill, and a resolution will be sent to the State Senate next week. As you all know, Vietnamese Americans immigrated to the United States after the end of the Vietnam War in 1975. We were very blessed to have found a new home in the United States, and today, California hosts the largest concentration of Vietnamese in the country. Although American holidays are widely celebrated by many Vietnamese Americans, most still maintain ties to their Vietnamese heritage. And the most important holiday in Vietnam is Tết, or Vietnamese Lunar New Year's. One of the most important food for Tết is the rice cake, known as bánh chưng, which has been a traditional food for centuries and cannot be omitted during the Tết festival. This steamed sticky rice cakes are stuffed with different fillings and wrapped in banana leaves. It took 2 hours to prepare the ingredients and another 10 to 12 hours to cook them in boiling water so that the sticky rice expand and become airtight. That would allow them to be stored at room temperature for more than a week and still served fresh. That is how we have done this in Vietnam for centuries before the refrigerators were invented. Unfortunately, here in the United States, each year we struggle to buy fresh bánh chưng or bánh tét in the market, at food-to-go stores and restaurants, etc. They are simply just not available. And consequently, the only way to get fresh Vietnamese rice cakes is through family and friends who are willing to go through the time-consuming preparation process. Mr. Chairman and member of the Senate Health Committee, I humbly ask you to please consider passing the SB 969 to protect the Vietnamese American heritage for future generations to come. Thank you.
Good afternoon, Chair Hernandez and the member of the Senate Health Committee. My name is Jenny Doe. I am an attorney from the city of San Jose and chairwoman for Friends of Hue Foundation. I'm honored to be here today to support this bill. As Councilman Bui have stated, after 1975, millions of Vietnamese fled the country, millions lost their lives at sea, about 1 million reached America. Those who made it, those who survived the ordeal, many of them lost everything, and I mean everything. The only thing that they can salvage, the only thing that they can save and put forward to the future is the culture, is the traditions that they cherish so much to pass on to the next generation. As part of that traditions is the preparation of these Vietnamese cakes during the holidays, and namely the Lunar New Year. As a Vietnamese American, as a child who was born out of Vietnam, I can't imagine, I can't possibly imagine consuming that rice cake frozen. I can't imagine waking up on the first day of the year and anxious to cut that cake and find that it's no longer moisture, it's no longer soft, the way it's meant to be for years and years. Why is it that thousands of years, why is it that hundreds of centuries of years that of this practice that have no issues? And as Councilman Bui has stated, the preparation itself is a tradition. It takes hours to prepare, and it takes tens to more hours to cook. This process is also bring family together. This process bind people together. This is the precious memory that we must preserve. And then consuming it, you have to consume it in a proper way. Storing it in the refrigerator after so many hours is no longer the same. The current law required that we have to do so. By doing so, I believe not only that it killed the cake, it killed the sense of it. There's no way you can taste it the same. And in addition, killed the culture. I'm here as a member of the Vietnamese American community in California. I humbly respect and ask the member of this Senate Health Committee to support Senate Bill 969 to restore the ability for Vietnamese Americans to maintain this precious tradition while protecting the health of the public. Thank you very much.
I couldn't top that. I appreciate it. Good afternoon, the Honorable Chair Hernandez and members of the Senate Health Committee, and some of you I was honored to meet before. My name is Tam Nguyen. I'm a councilman for San Jose, representing more than 120,000 Vietnamese strong Americans who have a very rich and valuable cultural value. Today, I'm deeply honored to be here today to speak to you about the bánh chưng and the rice cake during our Tet Festival. It's known as the rice cake, which has been playing a very important role in our Vietnamese American culture for many centuries. The Vietnamese rice cakes are typically consumed during the New Year Tet Festival celebration, and also the King Hung, the founders of our country, to honor the ancient Vietnamese rulers. Historically, they've been used as token of gratitude to honor our ancestors and our homeland. Although we are physically away from Vietnam, the Vietnamese American community has worked to preserve our heritage and custom in our new home. Vietnamese rice cakes have allowed Vietnamese Americans like us to maintain our cultural ties and to present us with an ideal opportunity for families to bond during the cooking process. Today, we are able to purchase this rice cake, but they are not sold at regular room temperature, which is the manner in which our ancestors have done and consumed them for centuries. And me, myself, We've been all eating, and I've been very healthy all along. Today, we are able to purchase this cake as a representative of the Vietnamese American community in San Jose and in California. I respectfully ask your honorable committee approve this law to allow us to sell and purchase Vietnamese rice cake at room temperature. And with that, I'm deeply honored and appreciate. And also thank the leadership of the author, Senator Janet Nguyen, for this effort, and thank you.
Thank you. Anyone else in support, please step forward and state your name and your position. We can just limit to name and position. Thank you.
I am Hiên Nguyen. I'm coming from San Jose. I'm currently the treasurer of the Overseas Vietnamese Women Association in North California, and I'm here to support Senate Bill 969.
Thank you.
Hi, my name is Châu Lam Nguyễn. I'm president of the Golden Heart Foundation. I come here to in support the SB 969. Please to pass. Thank you.
Hi, I am Kem Hồng Nguyễn. I support the bill 969. Thank you.
Good afternoon. I'm Minh Ngọc Đỗ. I'm from San Jose. I support for Senate Bill 969. Thank you.
Good afternoon. My name is Don Ba. I'm the president of the Champa Traditional Association in Sacramento. I'm come over here to support the Senate Bill 969. Thank you.
Good afternoon. My name is Kong Do. I'm an engineer in Silicon Valley, more than 25 years. Silicon Valley in San Jose, we have more than 100,000 Vietnamese living there. I'm here to strongly support the bill 969. Please pass the bill. Thank you very much.